Yo guys, we're going to talk about something very important today. And when we talk about main issues, we're going to talk about what we call gynaecomastia. Gynaecomastia, that's what we're going to talk about. What is gynaecomastia? So guys, the channel is Nazvin. And kindly, if you have not subscribed, I want to encourage you to subscribe. My name is Vincent. Guys, this is where we get to talk matters medical in a simple language which we can always understand, and that is why you need to like the video so that this video gets to be recommended to your friends, to the larger population, so that you get to know what really happens in our medical field, because all we want is our slogan is health matters. So your health really matters to us. That's why we get to discuss matters medical in a simple language which you can understand. Guys, like, comment, share the video, and that is how you get also to support us. For direct support, we have our details in the description of the video and also on the channel, how you can reach us and also let us build this channel to the next level. Guys, gynecomastia refers to the enlargement of the breast tissue in males, typically caused by the imbalance in hormones. And when we talk about hormones, there are special two hormones, estrogen and also what we call testosterone. We are going to talk about generally about the overview about the gynecomastia. And the basic cause of this is about hormonal imbalance. And when we talk about hormonal imbalance, with an increase in estrogen as compared to testosterone. And I ever did a video on testosterone levels in male and also in reproduction. Kindly, if you have not watched the video, I want to encourage you to watch it so that you get to know what really happens. So hormonal imbalance, especially when we have excess of estrogen in the body of a male as compared to testosterone, so gynecomastia comes about. In puberty, temporary gynecomastia is common during adolescence due to the hormonal fluctuation. We have excesses of hormone during puberty. This is the age where now a child transforms to an adult. Sometimes we may have gynecomastia as one of the causes. And another cause is about aging, because hormonal changes in older men can lead to gynecomastia. Medications certain medications such as steroids, liver disease, androgens, and also some antidepressants. Antidepressants are which control the brain, so can cause also gynecomastia. Health conditions such as the liver disease, kidney failure, thyroid disorders, and also can contribute to this gynecomastia. How do you know you have this gynecomastia? Enlargement of breast tissue is one of the things, where one or both breasts can be increased in size. Swelling or tenderness in the breast area is also another thing. Sometimes as a slight increase in the breast size, but it can be normal, but larger growth indicates gynecomastia. So how do you make a diagnosis for this? Medical history and physical examination from the healthcare provider is very key, where blood tests also can be done to measure the hormonal levels and also testosterone and also estrogen levels. Imaging tests such as what we call ultrasound and also mammography can be done to help to rule out the causes. On the management, observation is very key, where in case of gynecomastia due to puberty or medications, observation can be recommended as it resolves on its own. Medications, hormonal medications is very key, where tamoxifen and also aromatase inhibitors can be introduced to recommended to solve on its own. Medications like what I've mentioned about tamoxifen and also aromatase inhibitors may be prescribed for to reduce the breast tissue. Surgery can be done also if it persists. If gynecomastia persists or the enlargement of the breast in the male persists, surgery is recommended. Or if it causes significant discomfort, surgical removal of excess breast tissue is very key. What we call mastectomy may be considered. On the part of prevention, we avoid substances known as to cause gynecomastia, especially anabolic steroids, excessive alcohol, monitoring medication, and discussing with the healthcare provider to help you come about with solutions. In case, also we have some complications related to gynaecomastia. Like they can cause distress in one, or self-consciousness can really be affected, and also can be a sign of underlying serious conditions, especially when you have testicular tumors. Some patients have been seen to develop the gynecomastia, necessitating the thorough evaluation so that one comes about with a very particular way of managing the gynecomastia as a condition. So gynecomastia is very common in some populations. So, and it affects a lot of individuals over the same. So it can also have underlying, can have other underlying things which can really bring a lot of issues at the end of the day, guys. Managing gynecomastia involves addressing underlying cause, alleviating symptoms, and if necessary, surgical interventions. And some of the detailed management strategies. Number one is about lifestyle and observation. We talk about what we call watchful waiting, where pubertal gynecomastia, this is often resolved on its own. This is what we, when one is during puberty, we said boys can change and have very big breasts, and this is because of the excess of estrogen. But what we call watchful waiting is very key, and often it resolves on its own within 6 months to 2 years. So regular follow-up with healthcare provider is recommended. If you suspect pubertal gynecomastia, especially when you have puberty son, it's very key that you get to be evaluated, and this is likely to resolve within 6 months to 2 years. Medication or substance use also is another thing you watch on. If gynecomastia is caused by drug or substances, discontinuing this may result in improvement. However, always consult with the healthcare provider before stopping any prescription medication. Lifestyle modification is also another way, where diet and exercise plays a very important role. Maintaining healthy weight can help manage gynecomastia. Weight loss may also reduce fatty tissue, which may not affect the glandular breast tissue. Avoiding triggers is also another way, where you avoid the triggers or substances which can cause gynecomastia, especially anabolic steroids, certain medications, and excessive alcohol consumption. Medical treatment is also another way of managing medications, especially what we call selective estrogen receptor modulators, or CERMS, or SAMs. Drugs like tamoxifen and radoxifene can help reduce breast tissue size in gynecomastia, particularly when painful or persistent. So aromatase inhibitors also, they are another classification of the drugs, where medications such as anastrozole, and also which can reduce estrogen production and sometimes used in treating gynecomastia. The steroid replacement therapy, or what we call TRP, in case of hypogonadism, or where we have low testosterone levels, the steroid replacement can help balance hormone levels as appropriate. Also, surgical treatment is also another form of management, and the indications for surgery include persistent gynecomastia, which lasts more than 2 years, significant pain or tenderness, psychological or social distress due to breast enlargement, failure of medical treatment to reduce the breast size. So those are the factors, the 4 things which can make you be done surgery. Is persistent gynecomastia, which takes more than 2 years, significant pain or tenderness, if you have pain or tenderness on the breast, psychological or social distress due to breast enlargement is also another thing. Failure if one has been put on some medications and they have failed to reduce the breast size, surgery is recommended. And we have 2 types of surgeries which can be done. We have what you call liposuction, where this basically removal of excess fatty tissue from the breast area, suitable for cases where gynecomastia is primarily due to fatty deposition. Mastectomy is also another way, where surgical removal of glandular breast tissue is done. This can be done using minimal invasive techniques, which result in smaller incisions and a faster recovery. Psychological and social support is also another thing, where counseling, psychological support, counseling or therapy can address emotional and also psychological impact of gynecomastia. Support groups also for the people affected with this condition is also a very key thing, where a group of men with gynaecomastia can provide a sense of community and a shared experience. Monitoring and follow-up is also a way of managing it, where regular checkups, follow-up appointment with the healthcare provider to monitor the condition, especially in adolescents, to ensure it resolves naturally. Monitoring hormonal levels and adjusting treatment as necessary is also another way. On this gynaecomastia management, it involves combination of lifestyle changes, medication treatments or medical treatment, and in sometimes surgery of liposuction, and also what we call what I've said about mastectomy. So when we talk about complications which can come about with gynaecomastia, complications related to gynaecomastia can be both physical and also psychological. Addressing these complications can early on, it's very important for overall well-being and also of an individual. So some of the primary complications which come about, we have physical complications as number one, where we have persistent pain and also tenderness. And this enlargement of breast tissue can sometimes be very painful, especially if gynecomastia persists for a long time. On the management over-the-counter medications, relievers, pain relievers, hormonal treatments, or surgical, if very severe, is recommended when we have persistent pain and also tenderness. An increased risk for breast cancer is another complication which can come about, which while it is very rare in men to have this breast cancer, gynecomastia have a slightly increased risk for developing breast cancer. So the management of this is regular breast examination and also medical checkups to monitor for any changes or lump for breast tissue. Infections or abscess is also another complication. With this, gynecomastia can result in severe inflammation, or if surgically performed, there is a risk of developing infections or abscesses. So the management of this is prompt medical treatment with antibiotics or drainage if an abscess is formed. Psychological and social complications is also they're classified into emotional distress, and this gynecomastia can lead to feelings of embarrassment, because normally it is not expected a man to have very big breasts, but this can really be a problem. So this can lead to embarrassment, so low self-esteem, social anxiety, and also particularly in adolescents and also young men who are growing. Social isolation is also another psychological complication and social complication, where we may have because of the visible gynecomastia, may cause affected individuals to avoid social situations, leading to isolation. They want to hide themselves from the general public. So this one also can lead to social isolation. With this, we want to do psychological support, building support networks, and also potential considering surgery to alleviate the stresses. Body image issues also comes in. With this, gynecomastia can negatively impact the body image and also confidence, especially during puberty or significant life events. So the management of this is about counseling and also addressing underlying psychological issues or conditions that can contribute to body image issues. Complication for treatment also comes about because sometimes side effects of some medications which treat gynecomastia, such as hormonal treatments, can have some side effects on the body, like they can affect the mood, they can bring about the nausea and also the liver function alterations. So the management of this is regular monitoring by healthcare provider, adjusting the medications as needed and addressing side effects promptly. Surgical complications also can come about. These can come about because the removal of excess breast tissues can result in complications such as scarring, asymmetry. Asymmetry means one looks the other side, both sides of the chest don't look the same. So we have that asymmetry, and it's really not a good thing for the image issues. So hormonal therapy, lifestyle changes, and addressing underlying medical conditions can also help this. So choosing a qualified surgeon especially when we have surgical complications, is very key. Following postoperative instructions as addressed by the doctor or your healthcare provider is very key, so that any complication can be approached as early as possible. Impact of the quality of life is also another thing where sexual function is affected. And this comes about because of hormonal imbalance caused by gynaecomastia, which can affect the sexual function, leading to issues such as erectile dysfunction or reduced libido. The management of this is hormonal therapy, lifestyle changes, and addressing underlying medical conditions, which is very key. Impact on the physical activities. So the discomfort or embarrassment associated with gynaecomastia may limit participation in the physical activities, particularly those requiring shirtless participation, e.g. swimming. So the management of this is to encourage one to have supportive compression or compression garments, addressing psychological barriers to participation in those games which need to expose the neck, or not the neck actually, the chest. So on the prevention part of it, avoid hormonal altering substances like steroids and also medications. Management of chronic conditions such as thyroid disorders, because hypothyroidism or hyperthyroidism promptly can cause these problems. Liver and kidney health is very key. Maintain liver and kidney health throughout your life so that you have regular checkups, and managing conditions such as cirrhosis and also renal failure. Lifestyle and diet, they are very key as a preventive measure. Where diet, eat a balanced diet rich in fruits, vegetables, lean proteins, whole grains. So to limit the intake of processed foods, such as sugar and also unhealthy fats. So exercise comes handy. Engage in regular physical activity, including both aerobic and also strength training exercises to maintain healthy weight and also overall fitness. Limit alcohol consumption. Excessive alcohol intake can affect liver function and hormonal balance at the end of the day. So this increases the risk for gynecomastia. So drink alcohol in moderation or avoid it altogether, guys. Avoid recreational drugs such as marijuana, heroin, and also amphetamines, because they contribute to hormonal imbalance, and this really can daily affect you. Regular health monitoring is also as a preventive measure. Regular medical checkups is very key with the healthcare provider to monitor your hormonal levels and detect the hormonal imbalance early so that you have underlying conditions addressed as early possible to prevent gynecomastia. Breast examination is also another strategy where we have regular check for any changes in breast tissue such as lumps, swelling, tenderness, and report any unusual findings of your healthcare provider. Medication management, review medications as appropriate. Review all medication with your healthcare provider to determine if it could contribute to gynecomastia. Discuss alternatives if they are very necessary, and also to prevent recurrence is also another way where you adhere to prescribed medication for underlying condition as appropriate, and also hormonal balance to prevent recurrence of gynecomastia. Post-surgical care is very key. If surgery performed, it's very key that you follow up with your post-operative instructions with your healthcare provider to prevent complications. Also attend follow-up appointments as scheduled to monitor the recovery and address any concerns. Also address the psychological factors is also very key, where stress management comes very handy. We are practicing stress reduction techniques such as meditation, yoga, deep breathing exercises, hobbies to maintain emotional well-being, and also which indirect support hormonal balance. Counseling and also support. Seek counseling and join support groups to address psychological impact of gynecomastia as much as possible. Also, as a preventive measure, environmental factors, minimize exposure to environmental estrogens, limit exposure to environmental estrogens, especially which are found in plastics, personal care products like the oil which we apply on our skin. Pesticides can also contain this. So opt for PPA-free products and natural organic personal care items, especially for those who participate in beauty of our skin. So that's very key. So preventing gynecomastia involves a combination of lifestyle modifications, regular health monitoring, and careful management of medications and chronic conditions. By maintaining, guys, this health lifestyle, avoiding substances which can alter hormonal balance, and staying vigilant about changes in the breast tissue, it can really help individuals to reduce the risk of developing gynecomastia. So regular consultation with the healthcare provider is very key to ensure early detection and also effective management of any potential issues. Guys, that's about gynaecomastia. And also I want to welcome you to our next video. Kindly like the video, watch the video, share it with your mother, your grandmother, your grandfather, your cousin, your anybody, your loved one, so that we get to share that information as this. That's why you are in this channel. The channel is Nazvin. Kindly I want to welcome you to our next video. Peace guys, we love you very much.